Very good afternoon. Speak English, okay? No problem. All right. So this is almost the second time. This is the second time we give the same lecture almost. For those people who attended in the morning, what I'm going to talk about is about the stem cell per se, and maybe the second half, maybe we will talk about different application than when we talk in the morning about more related to the woman, how we can use the stem cell. So what I'm going to go through is actually what is all about the stem cells and in meaning of concept to understand about the cells. So those who will read in the morning, please bear with me because that will be a repetition for that. Okay, what we need to understand about the concept and the principle of stem cells, that when we are in certain age, that there is some sort of tissue that can be repaired. And that's one capability of our body. When we grow older, we will lose that capability to repair, or otherwise we will start to heal. And when we get older, we start to lose organ, and that we will fail to regrow things. So that's why this came from the principle that if there is some signal in our body, that can we regrow ourselves back. So that is actually the principle from the stem cells. So what happened here, you need to understand that in our cells there are more like 10 trillion types of cells, and from those all 10 trillion type of cells, there are actually that 200 type of these cells can be regrow back, and this is come from the principle of the stem cells. So when we are in the very young, when we are in the unit in the tummy of our mothers, we will come from one principal stem cells that will give the signal for all the other cells to differentiate into different type of our organs and body and so forth. All right, now from this principle, when we said, okay, if there is a principle of creating cell, might as well we try to do it in a different age instead of doing it in the age of neonates. So we will talk about one womb, which is actually called planaria. So what is so special about this planaria? It's just a normal womb, but one thing about this womb, if you cut the head, the tail will grow. If you cut the tail, the hair will grow. So that's actually, can we do that for the organs as well? So if we are able to regrow part of the human body, that will be great. If we're able to regrow organs that is already failed in certain part of our life, that will be also great. That's the principle of the stem cells come from. So what they try on, that is actually was the best part of it, is actually if we are able to regrow parts of the body that is lost already. And that's when it's come to those during the war injuries, the people who use legs or foot or fingers whatsoever. And interestingly, they're able after all to grow parts of the body like ears, they're able to grow bladders, which is more complex organ part of our body. All right. So now the question is, are we close to the womb, that planaria, that can we do something like what the wombs can do? Okay, so all over the world there have been a lot of studies, and it's been done. It started very long ago, since 1981, and they start to harvest what we call the stem cells. Actually, the studies, and much longer than that, they start with animals, and they're able to do that with the sheep and different type of animals to extract from them stem cells. And what they do, they take part of the genetic code to make it match to the humans. And they're able to use it to make the humans are more memorial, they don't lose their memories and so forth. So basically, that's when I start in the human on 1981, and we started in a level when those people, 1998, and they're able to harvest the normal embryonic stem cells, and the shift in the paradigm was in 2006 when the Japanese, they're able to use some sort of advanced type of stem cells. Right, okay, what do you need to know about the stem cells? And that is the most important thing. There are many types of stem cells, and they have a lot of criteria. But now, just we simplify it in two criteria. Criteria number one, it can renew itself. So the one cell can divide into two, the two can divide into 4, and 4 to 8, 8 to 16, and so forth. That's number one. Number two, it can differentiate itself into different types. And that's why when you create one type of stem cell, it can actually differentiate into different type of organs. That means it can heal different parts of our body. So apart from that, there are many criteria. We don't want to go to the scientific part of it, but let's understand actually, we are talking about the stem cells. Maybe somebody they are not really familiar with it, but actually it's been started a long time ago, and this paper is published in 2011. By that time, stem cell tourism estimated to be $3 billion a year, right? And at that time, there were more than 700. These are 700 clinics worldwide talking about stem cell. They are official clinics with stem cell. So what we can treat with the stem cells? If we knew about that the stem cells is come from what organ, then we will know what type of organ that we can treat. And that's why there are actually more than 65 major diseases that we can treat with stem cells, right? Okay, now back to this two main criteria, that it can replicate itself and it can differentiate into many type of cells, right? And remember, all the cells are basic cells. So that's mean when you talk like this one, dendritic cell, this involves all the nerves. Dendritic cell is the name of the neuron, the original cell for the neuron, for the nerves, saraf. So it can cover all the brain, spinal cord, movement, arm, Parkinson's disease, shivering, tremor, all is just because of this one type of cell. And this is how wide the treatment with the stem cells can be. Right. Okay, now when we talk about the types of the stem cells, maybe we didn't talk that one in the morning, it can be harvested in all the time of the day. The stem cells have come from the primitive time when you have only the sperm and the ova from the mother. That the time actually then you can harvest the cell, what we call the blastocyte. Now when the baby grow up and the embryo and it's come to be like a fetus in the mother abdomen, it's actually, that's the time when you can actually harvest the first type of stem cells, and this we call it embryonic stem cell. Now in the infant, when they born, we can harvest them from the cord or the water jelly, and that's we call it postnatal stem cells, and the last what we have adult stem cells. Now from each one of these, they have all the divisions and the divisions in order to have different type of cells. Okay, but usually now we found actually, after all, from all the researchers, the best is actually the one between the 1 year into 6 years before reach to adulthood. But eventually we want the type of adults. That's actually help us, because this is the time when you start to have all your sicknesses. All right. Okay. One thing when you talk about is the potency. The potency is actually what can these stem cells can do, and how powerful are the stem cells. So now in our body we are all come out from 3 layers only. Okay, 3 major layers when we grow up. It's the ectoderm, mesoderm, and endoderm. So 3 layers, and each layer will divide into different. One is going to form the skin, subcutaneous tissue, and fat, and so forth. One will go to the organs, one go to the muscles, and so forth. So now if we are able to give us cells that cover all the layers, then we are able to treat all the diseases as well. Now to be more specialized, there are some people actually what they do, they take type of the cells, the neuron cells, and they implant into the nerves, like that. You have a cut nerve, for example, they take one type of cells, a neuron cell, and they implant into the nerve itself. That is very specialized. This one we call it undifferentiated. Alright? Okay, now the stem cells can exist in any part of our body, and if we know that the stem cells can come from any part of all these, then you have to understand, then we can treat all these types also back. So that means whatever it came from, we can implant it back again. Right? Now in our lab, what we harvest the cell from the teeth, from the kidneys. Now the main types of cells, when we divide it into 2, which is the postnatal stem cells and the adult stem cells, there are places where we can harvest the cells. From the postnatal host for the newly born is the water jelly or the cord from the cord, the placenta itself, and that's why now all the placenta products in the markets, they are all top expensive, because actually they are very rich in the stem cells. But keep in mind, actually a lot of them, this is just a commercial advertisement about they are actually placenta and placenta, but is true, if it is a true placenta and is expensive, is actually because it's contain a lot, is very rich in stem cells, right? And the humans, then we can, from the adult sorry, then we can actually harvest from bone marrow, dental pulp, adipose tissue. That's mean the fat. Adipose tissue is the fat. Peripheral blood is just like normal blood. Okay, now bone marrow, now we stop doing it because it's actually very invasive and painful. So we go for something is less invasive. Now the best what we found now, the dental pulp, which is actually in those adolescents when they lose their teeth, it is already thrown out. So we pick it up and we collect the stem cells from that. Right? These are the steps when it is go through in order for the preparation in the lab. So it's actually there are almost like 8 steps from the step number 1 when we collect the cells from the donor to the cell to the preparation, final preparation before we release the stem cells. So between each one of them is actually around like 2 to 3 weeks. The whole process will take around 3 months for the preparation of the cells. These cells are all prepared from a donors that doesn't belong to the patient, and they are all non-allergenic. That means doesn't cause any allergy. And this type, it doesn't go through any preservative, so it doesn't cause any sort of allergy and doesn't need any matching. Not like before, we need to do like is match the blood, tissue type, whatsoever. Now no more. So these are now already made. For the moment that the patient he wants the cells, is we can give it to the patient within 2 to 3 days. But the preparation for all this will take around like 3 months. Right? And the survival of the cells from the cryopreservation, because we keep it in the nitrogen minus 190, to the time we release the cells. If we decide for the cell survival only 6 to 8 hours only. That's why it is live, human, non-allergenic cells. Right. Okay, these are the tests that will be confirmed, and you will get a certificate when you get the stem cell that it passes through all these tests. In any of the stages, when you have any like failure and any of the tests is negative, the whole batch of stem cell will be discarded. Like that. That certainly is very important. So these are some of the methods how they do. We talked in the morning about some of the diseases as well. There are patients they used to use, especially for those people who have thalassemia or sickle cell anemia, they used to do the bone marrow transplantation. I'm going to show a picture after that. Bone marrow transplantation, they have to take the bone marrow. Usually they take it from the iliac crest, from this area. Then they harvest the stem cells. It's actually because those patients, they need the genetic code for them. So we cannot use a normal stem cells. We need to know what type of genetic code they have to treat the disease. This is the dental part. We take it from this part, center part of those. So it's just a small material. If you notice there, this is just a small one. Actually, we harvest few cells, and the cells will go through into divisions, and we go through it. Okay, adipose tissue fat we can take from the fat, but the problem with the fat is this is a bit invasive because it's considered a surgery. It still can be done. Peripheral blood, one of the methods you can do it easy and good, but the problem you need to take a lot of blood. You cannot just take like 5 or 10. We need at least 200 cc. So some of the patients who have sickness is difficult to get. This is from the baby. We call it something, we call it Wharton's jelly. This is the Wharton's jelly. This is actually the cord itself, the placenta. When we open it, this is what we found. So we can take from it, or we take from the placenta itself. We just take the pure blood from the placenta, then we can get. Right. The cells will be kept in the minus 190 degree. Is a nitrogen, is a specialized lab, and this is our lab. And the cells also, if you have a newly born baby or so, actually you can sign a contract with them, and you can keep the cells for your baby 20 years, 30 years, 40 years. You don't know if the baby got any sickness later when he grow up whatsoever. He can give to himself, to his kids, or something like that. Now it's quite cheap. I mean, not something expensive if you want to keep your stem cells for your kids. Sometimes you keep your stem cells for the kid, but actually eventually the father or the mother are going to use because they are genetically so matched together. Although we don't need the genetic matching here, but it's actually they do that as well. So it's like it's a family business to keep for them. Now, for the ladies per se, I mean, there are a lot of usage of the stem cells for injection to the faces and so forth, and that is actually been used a long time ago. But in order to know why you need to do that, there will be a lot of changes over the years. So this is actually, it just show like there are many places that you can inject the stem cells. Now everybody like very familiar, and all the aesthetic clinic they do the fillers, right? And the fillers is actually to pulp up the face and everything. The stem cells, it does that as well, but it doesn't actually do it in a matter of change the shape. It's in a matter of actually to replace your dead collagen tissues. So your face will keep that shiny looking and everything. And of course the stem cells, one of the things is because it contains a lot of melanocytes as well. This melanocytes is the cells of your skin, which is responsible for your color of the skin. So when you give a fresh one, this actually can give you, make you fairer even. So that's one of the things actually, if you have a face who like, you have a precipitate like to have these type of wrinkles, is actually you can get it before you go to that level. So it's a matter of fillers, but use a simple injection, but it actually will flare up your face. Like Dr. Raya doesn't need that lab because you're already flared up. All right. Okay, now, what's happened? Why all the lady thinking about wrinkles or whatever, man doesn't go? But this is actually, the slide is actually, maybe we can use it for man and woman, but you have to understand, the changes can start as early as 20. The major changes that happen in your skin integrity when you are in your 40s. Then now when is the irreversible one when you are at age of 50s. So now, the good thing about it, before you reach to the level of the scarring and hardening of the skin, you can replace still the collagen. What the fillers it does actually is that what you see from the dermis layer, when it is have this type of shape, what it does is actually will make it like equal by filling this gap. So we'll make it back, looks like normal. So basically after a while when the fillers will be absorbed by the body, the gap is still there. Okay? Like in cases of when you use the stem cells, it doesn't do that. It will replace the whole layer. So it will have the layer to get the tonicity back. And the tonicity, you will never get it by the fillers. The fillers is actually give you tonicity because it's filling up. So the face looks like tuka, and you feel like it's hard, but the hardness is actually because of the volume only. And the stem cells you don't need it because we give very minimal amount. So you will prefer 100% that the collagen itself will start to replace itself. And the problem now, the more you grow up, the more the blood vessels actually will lose its thickness. So we know enough nutrient to the face, and that's why we always emphasize try not to use a lot of makeup, try to keep the face as fresh and bright, because this is actually all will make the less blood supply to the area, right? So the major difference in when we talk about stem cells for the face is actually because it actually can replace your dead collagen fibers, and that will actually keep the face. It's not only about how to get rid of the wrinkles only. Right. Okay, now this is one of the latest, which actually is blowing out now in Korea and the Asian country because they have stem cell bra. Alright, so stem cell bra is actually can grow up the breast, and they started with a younger age as 20s as well, and it's been doing very well because it's affecting no side effect from it. The implantation is actually is hard to fit with you have to use the same bra for a period of like every week, like on and off or something like that, but it's eventually as if you are taking an injection weekly, something like that. So now it's actually, you can search about it, there's actually a lot of study about this stem cell bra, and apparently it's doing good work, apparently. Okay, now, and there's a big center that is actually, that first is actually open in Texas stem cell. Texas stem cells, what they've done, they opened, this is actually a free organization. What they do, they collect all the type of the blood from the patient, from the newly born babies, and they are opening all the type of donations. So the idea of all the center is actually to help for the organ transplantation. Okay, so what you see here, there are major movement in the whole world actually is come from a very simple, noble idea, which is actually the stem cell. So now, apart from the stem cell, this can help to treat a lot of sicknesses. There are a lot of novel ideas behind it. Of course, for hair growth, that is an established. There are many ways of going in. They have a shampoo, they have a spray, they have injection, as if you are doing so. No more hair transplantation. Then even they can just give an injection whatsoever, right? There is a new type of cells. Stem cells is being designed to treat people, female who have sexual dysfunction. So now, for the female, when they reach to a certain age, there is a special gland in the body, we call it Bartholin gland, and this gland actually can get aged. A lot of ladies, they may get it as a sickness, as a disease, an abscess collection or something like that. It is stay in the vagina, and is actually one can cause the secretion of a lubricant, and from it come all the sexual desire and so forth. Now, if that gland is actually failed, so female we call it is a sexual dysfunction. That is not age related. This is actually more into performance, functional related. So now they're able to treat that with the stem cells by injection locally and systematically, and it's already now an established treatment actually. So the lady have any sort of Bartholin cyst or Bartholin abscess and have sexual dysfunction, so they can give what we call the cells, right? Okay, now if we talk about female in general, they are more prone to spinal cord injury or nerves injury more than the male. All right. Now the stem cell already been established that is actually improve the nerve myelination. Myelination is actually the growth. Myelin is the layer that cover the nerves. All right. So they start a study. This is a long time ago, of course. Okay, they start the study. This is established in 2009 with a paralyzed mice, and this is after 6 weeks he can stand on his leg. All right, and this is the nerve when it's injured. Just keep in mind, see, the nerve is totally injured, and this is actually how after you do the transplantation. And that is actually for all those ladies who have like what we call carpal tunnel syndrome. Something is very common for the ladies. They have like weakness and numbness, especially after delivery, which is very, very common. Treatment most of the time, either you inject steroid or you can inject what we call, or you can do a simple surgery on the forearm, on the wrist. Now is actually they stop doing that. They are just giving them the stem cell injection. Is actually can cure and can improve the nerves like almost like to 80%, and that will be enough to cure the disease. A lot of spinal problem in the female because of the delivery and the carrying the weight and everything. They have a lot of disc prolapse, and now they are using that method actually as an alternative. Right, okay, this is maybe more into spinal cord injury when we talk about cervical injury, thoracic, lumbar, and actually will tell you how much of the lost nerve that you can do is actually the higher it's, the more involved the whole body. And those people who have even like level like in the thoracic or even in the mid-thoracic or even in the lower down, keep in mind, this one is actually, mainly talking here about trauma, but even female after delivery, normal vaginal delivery, or sometimes they give them like all this epidural injection, they got like nerve injuries whatsoever, they will end even with sometime with L4, L5, L1 injuries. It's been like have a very good result using the stem cells, because when we do the stem cells, remember, it can improve the nerves and grow it up. Right, now I think this is my last slide. That is actually something that the ladies are more prone to it, which is when we talk about patient is with hyperglycemia or diabetes. Right, now when the patient come to us and have the diabetes, the treatment will not be as simple. We can give the medication only, or just simply we ask the patient, stop, don't eat sugar, it doesn't work all the time, because sometimes you have to understand sugar control in the body is come from many organs. So it starts from every single part of it. One of them is the pancreas. One of them is actually how your brain is secreting all the neurotransmitters, that is actually the nerve signals in the body. Right, your liver, your muscle, your blood vessel, your nerve cells, the kidney, or if there is like decrease in secretion, if we talk about the pancreatic cells. So now, all this actually, when you come to try to treat the diabetes, you have to take care of all this. But eventually, if you know that the major part, if you don't have like insulin, or the insulin is not coming up in your body, the only secreting is actually stem cells, is actually can replace back your pancreatic cells. That's one. Two, most of the time we find actually that the problem with the people who have sugar is actually because they're insulin resistant. So maybe your body is secreting, but the insulin resistant in the body, and that's one of the inflammatory process. So the best anti-inflammatory thing to give is actually the stem cells. But now we are not talking about giving a treatment in a matter of just like try to control the sugar. We are talking about cure here. We are talking about curative management of diabetes, which is actually already been achieved by the stem cells. All right. Now this is my slide. Okay. One of the diseases that is very related to the autoimmune disease and SLE, we call it SLE, systemic lupus erythematosus, is actually, this is an autoimmune. Your antibody inside you will attack your body. It can attack every single part, from the skin. Oh, sorry. What's that? From the skin to the heart, to the blood vessels, to the muscles, kidneys and lungs and so forth. You got like all this rashes and redness and everything. Now, a lot of females, they have what we call subclinical SLE. What does it mean? That means you don't have the SLE per se as a disease, but actually you have a lot of signs and symptoms of that. And if you accept the fact that you are in certain part of your life, you must have like something like rashes or changes in your skin whatsoever, then you are wrong. There must be something behind it. And that's what is actually the total general inflammatory process in the female is something is very major to talk about. But using the stem cells, you can early target each one of all these problems. And even if you are talking about somebody who doesn't have the sickness even, is still stem cell have a very good anti-inflammatory marker to reverse all these changes. So if you have any of things that you think is not right in you, better you check yourself. Sorry. And if all your hormonal assay after all by the checkup is tend to be like normal, then something to think about sometimes is good to have a boost of these type of stem cells. This is actually apart from having you like to make you as better for your memory whatsoever, it will help you to get rid of all these things. Even when you talk about the menopause with the hot flash whatsoever, it's in somehow can stabilize and neutralize this part because it's all about inflammatory process in the body. All right. Out of that, but this one of the things that a lot of our mothers, and they have this struggle with, they have babies with autism or cerebral palsy, it show actually as a great response in the cognitive personality or changes in those people who have autism, because autism is not a degenerative disease, it's just a matter of different in the stimulation on the nerve sites or the brain level. So basically the stem cells, what it does is actually just causes stabilization of the neurons. So it's stabilize the brain in general. It may not be that easy like from the handicap baby to a normal like playing whatsoever, not that easy unless you catch them in a very early time of their life. But there is a big hope even for those cerebral palsy, if you catch them early, they can change their personality, they have a better response, they can improve their physical movement and so forth. And in autism, like from crazy boy jumping here and there, is actually they can go into more stable and you can get them better quality of life. But the trick with all these type of stubborn diseases need to catch them as early as possible. Then the result and outcome will be quite good with a good neurorehabilitation. All right. That's when we talk about the new treatment for leukemia. Even leukemia is actually the cancer for the blood. In the past, they used to take what we call the bone marrow and everything, and have to do the bone marrow implantation. Now, not anymore. What we do here now is actually you give the chemotherapy, you ablate totally the bone marrow, then subsequently you give the patient the stem cells. So no need all this bone marrow transplantation, find the donor to get all the typing and everything. Now it's much straightforward, and actually it can get a very good results about it, right? Now, if you talk about stem cell transplantation, is one of the treatment to cure thalassemia as well. Okay, if the trick about it is actually if you can catch those patients in a very early stages. So now all these diseases before, it was actually not curable, not treatable. Now is actually we are talking about curing the diseases if you catch it in the early stages. Now, in summary, stem cells is something that more that you think it can treat everything almost, but of course, whatever been established is being established in treatment well-being as an anti-aging as well. It shifts the paradigm in organ transplantation because this is actually make you away from all this type of, even like we talk about kidney transplant whatsoever. Yes, it may not, those people with end-stage renal failure may not make them like out of that, but maybe reduce their requirement for the dialysis and so forth, and have a big potential to treat any type of the disease. And we are looking for more for any researchers in the future. Thank you very much.
We didn't finish the morning session.
Oh, yeah?
Yes.
Thank you. Make a stem cell for those patients. And what about maybe there is virus or bacteria or parasite inside our bone marrow? And
All right.
what happened?
Okay, so those people, so you have to know what type of antibodies they have. Those who they have, especially they have a massive type of antibodies in their body,
We do for them what we call plasmapheresis. So you wash them up. Plasmapheresis is something like dialysis, but dialysis we clean the body from the urea. This one we clean from the antibodies. So we clean all antibodies, and we know that we test the patient again. We do all the type of the C3 protein, C4 protein. We make sure that anti-nuclear antibody, they are all clear, and then we will give the stem cells. If we find the patient still have any sort of antibody, we plasmapheresis again, then we give the stem cells. Yeah, I mean your point is very exactly to the core of the disease, because not everybody we can treat. That's why I said stem cells can treat, but there are limitations for it. So sometimes we cannot do that. If you treated any type of diseases and you reach to the level that you give up already, and the patient doesn't have any other solution, stem cells can come and replace all this stuff as an alternative solution. This may not be the ultimate, but something is better than nothing.
Yes, looks like SLE, lupus erythematosus, you can treat with stem cell?
Yeah, as I said, but SLE we do for them a few sessions of plasmapheresis first, then we will give them the stem cell therapy. And they need at least between 3 to 6 doses, between each dose around like 6 weeks to 4 weeks, 6 weeks to 6 weeks. 6 weeks to 8 weeks, sorry, between each dose.
And also if the patient already have dialysis, hemodialysis?
Okay, for end-stage renal failure, we have some few successful stories. We didn't achieve to get like complete recovery or regeneration, but we able to reduce the control on the blood pressure, medication, diabetes as well in the same patient, and the requirement for the dialysis as well. So from instead of 3 times a week into twice a week, sometimes even once a week.
Yeah, if we have patient here, then how much it costs?
If that cost per se for the stem cells, we are talking about the package for 100 million cells, 100 million stem cells, that will be around between 17 to 18,000 USD. This is 17 to 19,000 USD. That's include everything, the hospitalization and everything, including the accommodation, transportation.
And where do you?
This will be in one of the hospital of KPJ groups in Kuala Lumpur.
Oh yeah?
Depend on the disciplinary way. Because all these, each one will go to certain, ortho go to ortho, blood disease will go to hemato, and so forth. Yes?
How about the patient with ACL injury?
What's that?
ACL, anterior cruciate ligament, torn with ligament.
Ligament. Okay, if it is a mechanical injury, it needs to be corrected mechanical. That means the patient definitely needs a surgery. So that the stem cells will not make the thing grow up back. So the patient he needs a reconstructive surgery. But if the inflammatory process is very massive, the doctor during the surgery he can give the stem cells, and we do it a lot. Because most of them, they will not come with you with unless you are talking about very young or have like football injury or something, that is very common. But those people who have like ligament injury plus OA changes, osteoarthritis, they will be very good candidates. So what they do reconstructive surgery most of the time, arthroscopic, and at the same time they give injection. As I said, sometimes they do even fracture in the cartilage, and they see where is the area the cartilage is weak, then they will give an injection. There. Like herself, she did as well.